You never know what a shift is going to be like. You have to be incredibly flexible and ready to adjust because you may have planned out your next 5 steps and then something rolls in to the trauma room and your entire day is going to go differently. My name is Karen Mangold. I am an attending physician at Lurie Children's and Pediatric Emergency Medicine, and I'm the program director for the fellowship. I think the patient population that we serve here at Lurie Children's is the reason to train here. Our patient diversity is amazing in so many different ways. We take care of kids with very complex, long chronic medical illnesses, but we also are seen as outstanding caregivers for people with stubbed toes and ear pain, and so we get to see kids with all of that. You get families who are really well versed with the healthcare system, have strong opinions, or have been through a lot with their kids. And then you have parents who have a lot of difficulty accessing care or low health literacy. And so it's a really great place to get training because it gives you a real grounding in pediatrics and how to work with families in an emergency department. Outside of that, academically, I think we have a really strong training program. We have an incredible faculty with a ton of great mentorship and a real wealth of opportunities here to offer trainings in pretty much anything that the fellows are interested in. We're looking for fellows who have a lot of internal motivation and are going to search out opportunities and move things along on their own. We have outstanding mentorship to help them along that way, but we don't have a lot of prescribed paths that we kind of force them to go down. We let them really explore options on their own. We've built our relationship with the emergency medicine department at Northwestern really nicely, and because pediatric emergency medicine and emergency medicine are so entwined, it's really nice to be closer to our colleagues down here. It allows us to participate in their conferences, teach their residents, have our fellows go over to their hospital, and go back and forth. It's also a fantastic neighborhood to be in. It is really easy access for the patients and has kind of an exciting vibe to be right downtown inside like a busy city. It's a very mature and collegial atmosphere. We try and treat our fellows as full members of our division, so they're invited and expected to participate in all division meetings, committees, and in fact, some of our fellows are the most active on some of our committees, and they bring a real energy to the group, which is fun. The division itself is very tight. We're incredibly supportive to each other and to our fellows as well. Emergency medicine is the kind of field where you're just used to things turning on a dime, and we all jump in and help out when it's needed. We socialize a lot together, and the fellows are always a fun part of that as well. And I think everybody is just incredibly supportive about trying to get each person to a place that they love their career and love their colleagues. And it's just a really wonderful group of people to work with. We have a leadership that's incredibly strong and supporting us in developing our academic lives in whichever direction we're interested in, and really pushing us to be leaders in research, education, advocacy, and quality improvement, as well as clinically for the city and the state and the country. So I think it's an outstanding hospital and really a wonderful place to train.